back to the Humorous Show. Today we'll be talking about a joint of the lower limb. I highly recommend you to tune in tonight. We'll be welcoming 4 guest speakers to discuss anatomy, innervation and blood supply of the ankle and apply this injury to a famous sports star. During this episode, we'll be using some advanced anatomical terms we have learned along the way. Now sit back, relax and grab yourself some milk before we dive into our injury video. Now let's watch Neymar roll his ankle. Appears our media team's having some IT technical difficulties. We'll be back in a second.
Ooh, is he faking it? Ooh la la la, looks like a coincidence.
Oh, did he do it himself? I think he was alone. It looks like a nasty twist to his right ankle, Steven.
They're calling out the sports doctor. A lot of attention on his right ankle. Looks like he won't be playing for the rest of the game.
Must be a big and ugly twist. They're bringing out the stretcher now.
How sad for Neymar, 10 days before the return match against Real Madrid. What a huge blow.
Very sad to see Neymar holding his face like that as they take him away.
Wait, a twist? Actually, Neymar's injury is more than just a twist. It looks like quite a severe sprain. I'm not sure these guys have considered how that foot bent and what was affected. Because that looks like an injury of someone who would not have been able to play the rest of that game and would need a long period of rest, much longer than 10 days in fact, before he can play again. Now these commentators don't look like they took some anatomy classes.
How serious do we think this is? Is he a good actor or has he actually injured himself this time? First, let's introduce Dr. Gao to talk about the general anatomy of the ankle before we go into Neymar's injury.
Thank you, William. I'll try to keep this simple with a breakdown of the anatomy by sectioning of bones, muscles, ligaments, arteries and nerves within the ankle joint. Let's begin with bones. The ankle is a hinge joint consisting of 3 articulating bones, the distal tibia and fibula and the superior, medial and lateral articular surfaces of the talus. These bones are held together by both a fibrous capsule and several extrascapular ligaments. The foot is comprised of several bones as seen here. These long bones are called the metatarsals. Metatarsal 1, 2, 3, 4 and 5. Metatarsal 5 is an important insertion site for a muscle that assists with ankle stability. This bone has 3 zones, zone 1 located most proximally, zone 2 and zone 3 located most distally. Before we go into discussing the muscles of the lower leg, let's first discuss the 6 main movements of the ankle joint. So, inversion is rotating the foot medially, eversion is rotating the foot laterally, plantar flexion is the movement where the top of the foot points away from the leg, dorsiflexion is the opposite of plantar flexion, supination is a combination of inversion, adduction and plantar flexion, and pronation is a combination of eversion, abduction and dorsiflexion. The muscles that are involved in lateral eversion of the foot comprise the fibularis longus and brevis, while the muscles that invert the foot include the tibialis anterior and posterior. These muscles attach to various points on the foot. The fibularis brevis attaches to zone 1 of the 5th metatarsal, as seen here. The extrascapular ligaments include the tibiofibular syndesmosis, which is in between the 2 lower leg bones, the lateral collateral ligament, which consists of 2 talofibular bands, anterior and posterior, and a calcaneofibular band. These are both innervated by the common fibular division of the sciatic nerve. The medial collateral ligament, which consists of 2 tibiotalar bands, anterior and posterior, and a tibionavicular band, as well as a tibiocalcaneal band. This ligament is innervated by the tibial division of the sciatic nerve. The anterior tibial artery branches off into the lateral and medial malleolar arteries to supply the lateral and medial malleoli. When the tibial anterior artery crosses the anterior aspect of the ankle joint, it then becomes the dorsalis pedis artery to supply the foot. The common fibular nerve bifurcates into the superficial and deep fibular nerve. The superficial fibular nerve innervates the lateral compartment of the lower leg, innervating fibularis longus and brevis, which invert the foot. Now, the deep fibular nerve innervates the anterior muscle compartment, which are predominantly involved in dorsiflexion of the ankle. Now I'll pass you on to my colleague Gina to discuss the specific anatomy of Neymar's injury.
Thank you, Dr. Gao. Now, after seeing Neymar's injury, let's analyse it and prove that he wasn't being his usual dramatic self and that his pain is justified. Let's begin with the ligaments. The first ligament that was affected was the anterior talofibular ligament, which attaches the talus and the fibula as shown here. The next ligament is the calcaneofibular ligament. This attaches the calcaneus with the fibula. The last ligament affected is the posterior talofibular ligament, which attaches the talus and the fibula. There are 3 grades of lateral ankle sprains. This is determined by the severity of the injury. Grade 1 involves a stretch of the ligaments, and the symptoms include tenderness and stiffness. Grade 2 involves a partial rupture of the ligament. The symptoms include tenderness, stiffness, and difficulty walking. Grade 3 involves a complete rupture of the ligaments, and symptoms include severe swelling and inability to walk without severe pain. Therefore, when Neymar's foot was supinated, it hyperinverted, causing a stretch in the ligaments, resulting in a grade 2 lateral ankle sprain. Now, as well as his ankle, Neymar also injured his 5th metatarsal. There are 3 possible fractures that could have occurred to this bone. Zone 1 fractures, or tuberosity avulsion fractures, occur on the base of the 5th metatarsal. The fibularis brevis attaches here. When sudden supination and plantarflexion of the ankle occurs, the tendon of this muscle can be pulled and can disrupt or displace the base of the 5th metatarsal. Zone 2, also known as the Jones fracture, is caused by the same movement. However, it has a larger adduction force with the ankle plantarflexed during supination. Zone 3, or diaphyseal stress fractures, occur in the diaphyseal stress fracture region, which is the proximal medial end of the 5th metatarsal. Now, after analysing the possibility of Neymar's injuries, it can be seen that he has suffered from a Zone 1 ankle fracture. Therefore, it can be concluded that Neymar's injury was in fact a grade 2 lateral sprain with a Zone 1 fracture in his 5th metatarsal.
The ankle supports a majority of the body's weight, so rehabilitation of injury must be managed properly, otherwise secondary injuries can arise. Treatment of an ankle injury can ensure a return to sport in 10 to 16 weeks, depending on the extent of the injury. The nature of this treatment does not need to be altered between type of fracture or grade of ligament tearing. Immediate treatment should include rest of the joint, icing, compression, and elevation to control swelling. Non-steroidal anti-inflammatory drugs can also be effective pain relief. The 2 main goals of injury treatment are to restore ankle strength and flexibility. In the case of Neymar's injury, rehabilitation for fractures of the 5th metatarsal can begin after surgery or 6 to 8 weeks of rest. For athletes, studies have shown that full weight-bearing exercises such as walking therapy and functional therapy with limited immobilization produce the best results for return to sport after 5th metatarsal fracture. This is also found to be the case in treating ligament tear, either partial or complete. Some different exercises to improve strength and mobilization of the joint include a calf stretch, ankle plantarflexion and dorsiflexion, resisted ankle inversion, resisted ankle eversion, ankle alphabet, and heel raises. Recurrent injuries can be prevented by taking cautionary measures. Numerous studies show relevant proprioceptive neuromuscular training can reduce repeated ankle injuries by 35%. Proprioceptive training refers to the production of motor output in response to sensory input. The goal of such training is to enhance the body's ability to adapt to changing environments, such as sudden changes in direction, subsequently preventing injury. Exercises include balancing on a wobble board or balancing on a single leg whilst completing other tasks like catching or throwing a ball. The other major interventions for preventing injury recurrence is external support in the form of taping, bracing, or orthoses, with not only a reduction in injury incidence but a faster resumption to training. Other treatments that could prevent injury recurrence include continued manual therapy, appropriate warm-up before training, ice after training, and choosing appropriate footwear and replacing worn shoes regularly.
Thank you to our wonderful guest speakers. You guys definitely paid attention during MSK. Now, let's apply the knowledge we just learned and give our own commentary to Neymar's injury.
Oh dear, it looks like Neymar sprained his ankle. This looks like an ankle inversion sprain too. Could be quite serious. Quick, get the doctor in the stretcher.
Yes, the way he did it was by landing on the toes of his supinated foot. This means his foot was inverted, plantarflexed, and adducted, or pointing inwards, with the toes pointing downwards and towards the midline.
He may have caused damage to some ligaments within the ankle during this sprain. The ligaments affected could include the anterior and posterior talofibular and calcaneofibular ligaments. These are the ligaments that connect the talus and the calcaneus foot bones to the fibula bone.
If this is a serious injury, he might even have a fracture of the bone of his small toe, closest to his ankle, also known as the 5th metatarsal bone. This fracture would most likely be on the part of the bone closest to the ankle joint, the most proximal part, which is known as Zone 1.
By the looks of his demeanor, he seems to be quite in a lot of pain. There could be several nerves that are affected by this injury.
Hopefully Neymar is not out for too long. But if he has indeed fractured his fifth metatarsal, he may require surgery and could be out for a while.
Oh no, and this is only 10 days before the return match against Real Madrid. What a huge blow.